There are various reasons that you might have sleep disordered breathing. One big reason, though, can be the fact that the tongue, as we fall asleep, can fall back and start to collapse our airway. We're the only mammal on the planet that for some reason has a collapsible airway. And the first sign of that occurring is usually going to be narrowing of the airway passage. Tissue begins to move as we breathe, and it sounds like snoring. Progression of that is airway completely collapsing to the point where we have an apneic event, which is cessation of breathing. Cessation of breathing can be a bad thing for obvious reasons. There's some comorbidities like high blood pressure, diabetes, things like that that can actually be exacerbated by cessation of breathing or apneic events.